Ovarian cancer affects approximately 222,000 women in the U.S., and it accounts for more deaths each year than any other cancer of the female reproductive system. Our next guest, Nancy, shares her story.
In 2003, at 41 years old, I was told that I had ovarian cancer. As a mother of three, this sent me into a state of fear. After surgery to remove the cancerous mass from my ovary, I was found to have no evidence of the disease. 8 years later, I was feeling so great, I was training to run a half marathon when routine lab tests came back abnormal. My cancer was back. This took its toll on me physically, but it was also a very emotional journey for me and my family. I've since had multiple recurrences, which I found, unfortunately, is the case for many women with this disease. It is scary to watch and wait for your cancer to come back. It's like a hurricane. You know it's out there. It's coming, and it is terrifying, waiting for that other shoe to drop.
Nancy is here today to help raise awareness about recurrent ovarian cancer, along with gynecologic oncologist Dr. Rebecca Aaron. And Nancy, first of all, thank you for being here. You look great.
Thank you.
How is your health?
Actually, since November of 2016, I'm happy to say I have had no evidence of my cancer returning.
That is such incredible news. And we acknowledge we don't know exactly what causes ovarian cancer, Dr. Nita, but what do we know?
Well, ovarian cancer is a group of diseases that can start in the ovaries or fallopian tubes. And unfortunately, there's no reliable screening test for ovarian cancer, and symptoms can be really easy to miss or misdiagnose.
So what should women then look out for?
Look out for things like vaginal bleeding or discharge that is not normal for you, particularly if you are past menopause. Pain or pressure in the pelvic area, abdominal or back pain, bloating, feeling full too quickly, or difficulty eating. Also, pay attention to a change in your bathroom habits, such as more frequent or urgent need to urinate and constipation.
Dr. Aaron, we know ovarian cancer is often caught in the later stages, which does increase the risk of recurrence.
Yeah, that's right. So unfortunately, 85% of women who present with advanced ovarian cancer will see it return in their lifetime. And once it recurs, that time in between each recurrence continues to get shorter and shorter. And previously, once women recurred with ovarian cancer and responded to chemotherapy, they really had very limited options at that point.
Okay, but here we are today. What
Here we
options
are.
exist now?
So I recently partnered with Tesoro GSK on the Not on My Watch movement, which was really designed to spread the word about therapeutic advancements for patients with recurrent ovarian cancer, such as maintenance therapy that may help delay a future recurrence in some women. More than half of women who are actually eligible to receive maintenance therapy are not getting it, and they may not even know about it. So it's really important for women to understand what their options are.
Dr. Nita, back to you. Who is at risk and why?
There is no sure way to know if you will get ovarian cancer, but here are some factors that may play a role. If you are middle-aged or older, your mother, sister, aunt, or grandmother had ovarian cancer, you have the genetic mutation BRCA1 or BRCA2, or have used estrogen or hormone therapy. Also, if you've had endometriosis, breast, uterine, or colorectal cancer, or have Eastern European or Ashkenazi Jewish background.
Nancy, I look at you. You've been through so much. Yet here you are. What advice do you have for others?
I like to tell women to speak up. Don't be afraid to have proactive treatment conversations with your doctor, to voice any and all concerns that you have. You know, I found a great healthcare team for myself, and they did come up with a plan that worked for me.
And Dr. Aaron, where can viewers get more information?
It's really critical for people to understand what the latest advancements are in treatment for women with recurrent ovarian cancer. And for more information, people can visit notonmywatch.com.
Dr. Aaron, thank you for being here. Nancy, thank you for being here. Best of luck
Thank you.
throughout
Thank you very
your
much.
future.